So I'm going to talk a bit about medication compliance, and as well as, what causes medication non-compliance. Okay, so medication compliance is usually it's a medication, like mental health treatment, for clients to comply to take their medication as prescribed, to manage their presenting concerns. For example, to manage their mood, to manage their anxiety, to manage their psychosis, their hallucination and delusion, to be able to give them the ability to sleep, focus, and stuff like that. Yeah. So in mental health, it is not new that medication compliance presents significant challenge for people, especially those that are struggling with mental illness as well as substance use disorder, or otherwise known as concurrent disorder. So if you are taking medication to manage mental illness such as anxiety, depression, psychosis or schizophrenia, at the same time taking medication to manage addiction of maybe alcohol, marijuana, or cocaine, or multiple substance use, then it presents a lot of challenge for them to take medication for both disorder. Yeah, because they have that dual diagnosis or concurrent disorder. So I'm going to give an example. Somebody can be diagnosed of bipolar and at the same time diagnosed with schizophrenia or substance use psychosis, yeah, or substance related psychosis. So it is important for a practitioner to be able to know the issue that surrounds medication non-compliance and how to support their client or patient or resident in their care as well as their recovery journey. So I'm gonna start with a little bit of statistics. Hopefully it's help with you understanding how serious medication non-compliance can be. And I'm gonna quote that medication compliance means taking medication as directed most of the time. So you're supposed to take, if your doctor prescribe you to take medication at bedtime, make sure you take it at bedtime every day until your doctor asks you to stop. If your doctor writes a prescription that you should take it as needed, PRN means you should take it whenever you feel like you need that medication. Take it as needed. Whenever you are experiencing like symptoms that you cannot control, then you take it as needed. So I'm gonna quote, non-compliance is usually defined as you are missing 20% of doses. So it means non-compliance. So if you are missing 20% of your prescribed doses, it means non-compliance. But it may also include outright treatment refusal. It can also include that you are refusing medication or you are not taking it at all. That is medication non-compliance. And so 20%, missing 20% can actually affect your treatment. It can impact your symptoms as well, can make your symptoms worse from that. So I'm gonna give a statistic. So people with schizophrenia have amongst the lowest medication compliance rate, with studies indicating approximately 40 to 50% non-adherence depending on the methodology that is used for the study. And this quote was taken from it's taken from the Bright Quest Treatment Center. Their website, you can check their website. Just Google Bright Quest Treatment Center. You will see a couple statistics there that they went into detail. So I'm gonna dive into what is the risk of non-compliance. What can happen? Why does some clients why did they not comply with their treatment? Why do they take their medication as prescribed? Or why did they refuse treatment at all? So and also the complication and risk of not complying with medication is what I'm going to talk next. So the first one is hospitalization and emergency psychiatric services. So if you are not complying with your medication, taking them as prescribed, there's risk that that patient may be coming to the emergency for hospitalization frequently than they should be, because they're always coming into the hospital whenever they're in crisis and unable to manage their symptoms. Mind you, some medication that is used for mental illness takes a while to kick in. Sometimes they can take 4 to 6 weeks to kick in. So if they have to start them on that medication again, then they are gonna take that medication for a while for the medication to kick in. Yeah, so if your patient or your client is not taking their medication as prescribed, they are at risk of multiple hospitalization as well as emergency psychiatric services. The second risk is aggression and even violence. So there are some medication that is used to control like your mood, your anger, you know. So if you are not taking them, then they are not working as they should. So again, the person is going to have the symptoms, the symptoms that they were having, that took them for psychiatric evaluation, and then they were diagnosed, but then they are not taking the treatments as prescribed. So there's potential that they are going to be aggressive or even be violent. Incarceration. So if somebody is violent, maybe they beat up somebody on the street, or they did something that is not acceptable, there's chances that they can be incarcerated, right? So if they're not taking their treatment as planned, their behavior, it can impact their behavior, and then it can they can be at risk of being incarcerated. So that is why there's even the justice system, there's a lot that they need to do in terms of providing more services for people who are impacted by mental illness. There's what is called community treatment order. I'm going to talk about it now. So community treatment order means you have to take your medication. You have to. If you don't, there may be warrants for you to be arrested and taken to the hospital, because they know that you need that medication in order to function. So community treatment order, CTO, basically means a judge wrote an order, or a doctor wrote an order, that in order for you to live safely in the community without being inpatient, you need to take usually it's a medication that is intramuscular, that is administered by the community mental health nurse, usually every 4 to 6 weeks, depending on your treatment plan. So if they see that you are not complying with your medication treatment plan, then they may look into putting you into CTO, where you have to go to the hospital and get injections that will work for like 4 to 6 weeks, and then the next dose is due, you go to the hospital, you get your injection, and according to research studies, it's really effective so far. So why don't some people take their medication? Another reason is homelessness. If you don't have a stable place to sleep, to lay your head on, to shower, to perform your activities of daily living, where you are couch surfing from one place to the other, there's risk that you may lose your medication at where you slept last night, and then when you're sleeping somewhere else the following day, you don't have that medication with you. So homelessness is also a huge issue in providing and managing care for people impacted by mental illness as well as substance use disorder. Victimization. So you may be a victim of a crime as well, because you are not taking your medications. You may be taken for granted and stuff like that. There may be decreased cognitive functions. There's going to be poorer life satisfaction, the quality of life of you not taking that medication, constantly experiencing low mood, depression, panic attack. That is not a definition of good quality life. So the person may also experience substance use and abuse because they are not taking their medication for that is helping them with withdrawal. They are not taking their medication because for their low mood or bipolar or schizophrenia. So they may experience more or worsen symptoms of their diagnosis. So what are the major causes of non-compliance? What are the major causes of why is your patient or your client or your resident not taking their medication as prescribed? One of the reason is lack of insight. And I think so lack of insight means they didn't really understand themselves and the world around them. So they don't really understand their diagnosis. So they don't really understand how serious, and how minimizing it can be. So they are not, so it can impact how they make decision to actually take their medication. So they don't know this, they don't acknowledge the severity of their illness, so it is causing them to see treatment as unnecessary. Another reason why a client may not be compliant is relapse. Relapse is a common experience for people with chronic mental illness. So even if they take their medication regularly, unfortunately, relapse may cause loved ones to lose faith in the treatment process and stop taking their medication because they believe that it is ineffective, or believe that they are beyond getting help. So such relapse can mean mania or psychosis, depression, which may further interfere with treatment, as well as loved one's ability to be able to take care of their loved one in a healthy manner. A very common reason is side effect of medication. For example, psychotropic medication can cause a lot of side effects, such as weight gain, being tired, being forgetful, cognitive impairments. So for example, another example is ADHD medication can cause you to have like poor sleep. When you initially start your ADHD medication, depending on the one that is prescribed to you, for example, Concerta, some of the common side effect is, you'll be having trouble sleeping. You may have heightened appetite, right? So if you are somebody who already you're struggling with your weight gain, you may struggle with your weight gain because of the side effect of some medication. So it is important for you as a client, or important for you as a social worker, to provide education to your patient that if they are experiencing side effects or adverse effect is side effect of medication that is serious or deadly, or that you cannot ignore. For example, side effects can be headache, vomiting, and nausea. Why adverse effect is something serious that need medical attention, such as maybe heart attack, or you are having suicidal thoughts from taking your medication, and it's making you feel low, even more depressed. So make sure, as a healthcare provider or social worker, make sure you discuss with your clients about their side effect or adverse effect, and the importance of seeing their practitioner to kind of reevaluate their treatment instead of them making that decision to stop taking their medication. So substance use is another reason why clients may stop taking their medication, because substance use is strongly related to non-adherence for a number of reasons. So if you're using drug and alcohol at the same time taking your medication, they can interact with each other. That is a number one issue. Secondly, if you're taking alcohol or drug at the same time you have a prescription for your mental illness, using drug and alcohol or other substance may impair your judgment to take your medication. So it can also increase risk-taking behavior as well. So that is why some people are not taking their medication. So as a clinician, I'm going to say it again, it is important for you to discuss this figuring out why are you not taking your medication. Do you think not taking your medication is make you feel worse, or it makes you feel better? And then just kind of like encouraging your client to see their patient, to see their practitioner, to reevaluate their treatment. When you're working with clients with concurrent disorder, or what is also called dual diagnosis, it is important for you to be able to have conversation about other services that they can access, such as safe detox, ensuring that they are getting diagnosis, accurate diagnosis, by referring them or getting consultation with psychiatrists or specialists, supporting them with their medication compliance. I'm gonna give an example. It can be just like ensuring that they maybe getting this, like there's this like a bubble pack that can remind clients to take certain medication at certain day. Discussing different kind of strategies that will help them with their treatment compliance. Opportunity for education about their medication is also important as well. Providing pamphlets, providing psycho-education is also important as well. A few weeks ago, I remember printing something off on the internet and giving to my clients as information that will help them to make sure that they are on top of the game of recovery. Yeah, so I think that is what this video is pretty much all about. I'm also going to use another resource. So if my face is all over the place, it's because I'm also looking at my computer, my notes. There was also another resources that I find that is really helpful that I think I want to talk about. If you go on Google, just Google 8 reasons patients don't take their medication as prescribed. It was published on December 2nd, 2020. So it is very common working with clients. Sometimes they, maybe they feel better and they just thought that it's either they feel better or they feel worse, or stigma. They don't want people seeing them taking medication. There's a lot of medical and socio-economic reasons why a client is not adhering to their medication treatment. So I am going to say there's another 8 reasons patient does not take their medication. Number 1 is fear. Fear that is related to side effects, weight gain, stigma, fear of being accused. Oh, are you crazy now? Those kind of comments, fear of being judged, fear of dependence, right? Fear of being dependent on that medication forever. So it is important for you to clarify with to kind of educate your clients that they don't have to take that medication forever. Being diagnosed with mental illness or substance use disorder does not mean you have to take certain medication till you retire or for the rest of your life. It can just be taking it till you're stable, and then you figuring out other strategies that work for you to recover or to be where you want to be in terms of your mental health. So the second one is cost. If you are not working, if you don't have any coverage for your medication, and you're already, you're homeless. Let's say you're homeless, you don't have a roof on your head, and you don't have good family support, community support. You're poor, or you're an immigrant. You don't even know where to get it. You don't have the money. So then cost of covering your medication becomes a barrier. And this is actually a popular topic of discussion when it comes to healthcare and being able to afford treatment, being able to afford medication. So the cost of refilling your medication when it is done, it may leave patients not filling their medication in the first place. So they may even ration what they do fill in order to extend their their supply. So for example, if their doctor wrote a prescription to be taking medication in the morning, in the afternoon, at bedtime, sometimes patient may make some decision to take that medication once a day in order for them to have longer supply. So in that way, they don't need to refill that medication as often as they should. Again, that is a cost issue that made that patient to make that decision. All right. So the third reason is misunderstanding. Misunderstanding. It is important for you to understand your diagnosis. It is important for you to get appropriate education from your pharmacists, from your social workers, from your doctors. Don't just leave that office with a diagnosis and a prescription. Just ask the doctor, so why am I taking this medication? How is it going to help? Making sure that you understand the reason, the why, and what and how of that medication and that prescription, as well as your diagnosis. Because I noticed that sometimes doctors don't have enough time to be able to provide detailed information when it comes to medication, understanding, and education. So I feel like the pharmacy, the doctors, as well as social workers need to be able to provide understanding to their client. Yeah. So if patient does not understand the need to take the medication, why do you think they are going to use it? So as a social worker, I have referred clients to call their pharmacy. I have referred clients to call their doctors, because what I can do is to research. If I don't have the time to research, I have a little background. I have background in nursing, which has really helped me in explaining some of these things to my client and patients. But oftentimes, I like to refer them to the experts, who are the pharmacists, as well as the doctors who made the diagnosis and the prescription. Yeah. So then the next reason is polypharmacy. So polypharmacy means too many medications, where a client is just taking too many medications to the point that they are so confused about the importance of taking all of the medication or some of the medication. So if you have a client that is older, they are more likely taking many medications for their arthritis, for chronic pain, for mental health, for many things. So sometimes a client may forget without even knowing, because there's so many medication that they are taking, that they get so confused about which one is doing for them. So what pharmacy have done for people that are struggling with polypharmacy, where they are taking so many medication, is the bubble pack medications, where it's like a bubble pack. I'm gonna put a link of bubble pack in the video, where they put like the date of the medication, the time, like evening or morning or lunch, and the date where so every medication for that day and time is put together, and what the patient just needs to do is to swallow it. Isn't that amazing? Yeah. So there's also like a plastic medication organization thing that patient can buy off dollar store to help them organize their medication in order to reduce confusion. Okay. So another reason is lack of symptoms, which means they are feeling better. So if a patient is feeling better, they'll be like, well, why swallow pill, right? Which is common sense. So why do you need to swallow Tylenol when you are not feeling any pain anymore? So for mental illness medication, it is important for them to continue taking that medication, because the moment they stop, then the symptoms may come back, and then they may start to have symptoms of being manic or psychosis, hearing voices and seeing things and stuff like that. So sometimes clients may stop their medication when they are feeling better. So the next reason I want to talk about is mistrust. And I think this one has a lot to do with kind of like marketing strategies and in the kind of like the pharmaceutical business, and in terms of just not trusting drug makers in general. So because of that, they discontinue taking their medication. So it is important as healthcare provider to inform patients that they may need to take medication for a long time as needed, and if they need to stop or if they need to change their medication because of any kind of symptoms, they need to follow up with their healthcare provider, with their specialist before they do so. And most patients are usually good doing that. So mistrust is just like marketing by pharmaceutical companies that influence. So for example, there are some physicians that like to prescribe certain medication than other, like that is when it comes to talking about brands and trade names of medication. So which means there are medication that does the same thing, but they are still, maybe the price is more expensive because of the brand or because of the trade names, right? So which may affect clients in taking their medication because they mistrust that brand because of what they see on social media marketing and stuff like that. If you are having issue with the cost of your medication, you can ask your physician if they can prescribe like a brand, instead of like a trade name, they can prescribe a different brand that does the same thing, but it is lesser. So people worry about taking medication. They are worried about stigma. They are worried about maybe they are crazy or certain things their family has spoken to them or friend. They are worried about depending on medication. Parents worry about their children depending on medication. So oftentimes they will try counseling first before they resort into medication and stuff like that. Medical doctors are aware of dependency when it comes to medication, specifically for opioids, which is like a pain relieving medication. So opioids are like stronger pain medication that helps to relieve moderate to severe pain. So which is like codeine or Tylenol 3, morphine, fentanyl. So those kind of medication, you will probably get morphine during after a surgery, or during a surgery. They can also discharge a patient with morphine at a low dose for very limited short period of time. There's no way somebody can be on morphine forever. It's usually like used for moderate to severe pain. So when it comes to being worried about depending on a medication, it is important for you to have conversation with your healthcare provider to be able to help you reduce your worry, and then you can comply with your treatment. So one way to overcome worry about being dependent on a medication is to improve patient-physician communication. So talking about that worries, there's no way your doctor will know that you're worried about taking certain medication if you don't have conversation with your physician, because your physician is not a mind reader. You need to have conversation with your doctor saying, am I going to be dependent on this medication, and am I going to struggle to stop taking this medication? And then they are able to give you honest answer that will help you to make informed decision about your treatment plan. Depression. This is gonna be the last reason why people stop taking their medication is depression. So have you ever been depressed where you don't even have motivation to do anything? Have you been depressed to the point that you don't want to shower, you don't want to get out of bed, you don't want to pick up your baby, you don't want to go to work, you just don't want to do anything. You don't want to do schoolwork. There's that no motivation to do anything at all. So when you are depressed and you don't have any motivation, you are likely not to take your medication as prescribed. So physician and other healthcare provider may be able to help you when you are able to share issues with them. So for example, they can, put you on another medication that will help you. They can help you by having conversation with you that will help you reduce embarrassment or express that many, because most patients have expressed, not having motivation to take the medication, or because they feel stigmatized to take medication because they have mental illness. If you feel like you are worried about taking your medication because of what other people are going to tell about you, take your medication, put it in a different container, label it in your own word that you understand what that medication is for. Again, it's nobody's business. This is your life. This is your mental health. Nobody is going to understand how your mental health is impacting you. It is only you that can understand how your mental health is affecting your activities of daily living and your overall well-being. So it is important to start taking that seriously and ignore the crowd. Ignore the crowd or educate the crowd. Educate them so that people can know that mental illness is real and it should be taken seriously like heart attack. It should be taken seriously like diabetics. It should be taken seriously like hypertension. So because why is diabetes not stigmatized compared to somebody taking antidepressant, compared to somebody taking psychotic? So use that opportunity to either ignore the public or educate them to create that awareness that mental health is important as physical health, spiritual health. So I am going to stop at that. If you guys have any questions, please comment below, like, subscribe, share my video. I am looking forward to sharing more topics with you. So have a wonderful week.